Hi, I'm Dr. Mike Milligan, a dentist from Illinois, and I'm here with Dr. Jonathan Parker of Minneapolis, St. Paul, one of the world-renowned experts in snoring and sleep apnea. Jonathan, thank you so much for being with us.
Thanks, Mike. I'm glad to be here.
So as a dentist, can you compare people who maybe have used CPAP to oral appliance therapy, and for those who can't wear the CPAP, why they might want to choose an oral appliance?
Well, about 50% of patients who have been prescribed CPAP are not able to tolerate it. So there's a huge population of people out there who are looking for answers. And an oral appliance is a simpler method. Essentially, the device will hold the jaw slightly forward, which opens the airway to allow them to breathe. And in patients with mild sleep apnea, these devices are somewhere between 70 and 80% successful. People with moderate apnea, it's somewhere in the 60 to 70% range, and even people with severe apnea, it's somewhere in the 40 to 60% range. So it's an alternative that people are able to tolerate and comply with, and it is very effective in many patients. So if you have somebody who's suffering from sleep apnea, and the health effects of that, you know, cardiovascular problems, increased risk of diabetes, etc., etc.
Yeah, many health
Exactly. Then we need to find something that they can tolerate and use effectively, and so an oral appliance is a great alternative to CPAP.
Now, what about kids, young people,
well,
who snore or have other problems, learning disabilities? Or
what we know is that kids shouldn't snore. It's an indication of a breathing problem at night, and it has been shown in research studies to impact behavior and to impact function during the day, and has also been shown to be connected with ADD. So what we need to do is begin to identify these kids who are having problems. So as a dentist, when we see kids come into the office, simple question of the parents like, does your child snore, or do they struggle breathing at all at night? Is a simple allergies is a simple way to just identify them, and then be an advocate for them to get it managed. Because what we know about snoring is it's an indication of struggle breathing, and it will impact growth and development. So these are the kids that will eventually or potentially be the adults with apnea who are struggling with all these symptoms and health problems.
We can prevent so many problems once they reach adulthood if we catch them early in their growth and development.
Exactly.
Train them to swallow properly, to breathe properly.
Exactly.
Get their mouth structures where they can.
Right. I think getting them into therapies like you mentioned, or structural therapies to help their growth and development, is really a big deal.
Jonathan, thank you so much for being with us.
Thanks, Mike.
Okay.